Thank you so much for staying with us here on Morning Live. Now, the Department of Health, in partnership with the Rotary Family and other partners, will for the next 3 days embark on a campaign to bring free healthcare services to the historically disadvantaged, underserviced areas and citizens. Some of the services available are TB screening and HCT campaigns with the aim to reach out to the masses at a one-stop shop event while also promoting healthy lifestyles, particularly where there is a lack of access to healthcare services. But to tell us more about this project, we joined in our studios in Johannesburg by Charlotte Khoza. She's a Rotarian. Good morning to you and thank you so much for coming through. And I was saying to you that I'd always, thought that Rotarians are just elder people. Is it changing now?
It is changing. It is one of the oldest volunteer service organizations in the world. It's an international organization. And I like the focus and the motto, service above self. So now we're trying to get more young people, because it's all about, continuation and all that kind of stuff. So we're trying to get more young people to be involved, especially if it is your passion to give back and, that kind of thing. So
yeah, beautiful initiative that's been going on for 5 years, and it's 6th year this year. It started in 2011.
Yes.
And I was also reading that you've actually helped over 1.5 million people in South Africa.
Yes. It's actually quite amazing, because then I think the most important thing is to actually know your status. Knowledge is power. And this is a free service that is provided at your doorstep, giving people an opportunity to come in and just have a screening, whether it's diabetes, it's HIV counseling, testing, screening, TB, all sorts of health services. We encourage the public and the communities to actually partake and join.
So how does it happen? Because I know it's in partnership with the Department of Health.
Yes.
Do you go to a particular place at a particular maybe a community?
Yes.
How does it work?
So what normally happens is that we've got close to 230 Rotary clubs nationwide. So now they would have a community that they normally service. So now they'll set up a site. We call site. We have over 100 sites nationwide, and we'll partner with the closest sort of like clinic from the National Department of Health, and then we'll provide the services at that specific site. So it's either a church, a school. It depends on the closest sort of like communal area in the community.
All right, so it depends on the locations where you go to. But in terms of people, taking part, what do they need to bring with when they go to those locations? They
just need to bring themselves. If you're going to bring kids, just bring the Road to Health map with them for immunizations, because we do offer that as well. And then just come see. You never know. There's counseling, there's testing, there's all sorts of things. It's just all about promoting your health and knowing. The most important thing is knowing.
But then previously, how has the response been? Are people really coming out in large numbers to go and test?
It is absolutely amazing, because the thing is, we encourage people to, if there's a mom koko next door that lives, just bring her along, bring everybody along. I think to date, we have seen close to 1.6 million people successfully. And the most important part is that there's also repeat, because now, should you find out that there's an issue or there's a health concern with regards to your health, they refer you to the clinic. So it's a continuation.
There are follow-ups.
There's follow-ups, exactly. So now this is just a place for you to actually just find out and learn more. And then obviously then that's what we're trying to
because
promote.
I get this thing where people only go consult when they're not feeling well.
Yes, yes. And that's what we're trying to change, you know what I mean? And the thing is, there's people in the communities that don't have access to it, you get home, especially if you're a working mom, you get home at a certain time. There's other health issues that you might not know that you have,
So it's always best to go check what happens. But you also have, the Rotary Family is also running a campaign that's called She Conquers, whereby you encourage young girls more so to stay in school and to know more about HIV and AIDS. Talk to us about that one.
That is actually a campaign that's run by the National Department of Health, and it's actually amazing, because now I think the focus is on young women and young girls. They're trying to focus on information that is surrounding the challenges of surrounding young girls and women, things like unwanted pregnancies, knowing your status, HIV, AIDS, etc. Also, trying to get away with that, the bless them mentality, trying to encourage them, to teach them, to show them all various opportunities that are around, and obviously gender-based sort of violence and that kind of stuff. So it's all focused on them, and from a health perspective, economic, etc., trying to empower them. With knowledge and knowing, and then these are the opportunities, you're not alone, and this is how you can improve yourself.
That's very crucial. With the high rate of teenage pregnancy in South Africa, such needs to be spoken about. Now, The relationship between the Rotary Family and the Department of Health.
Yes.
Talk to us about that partnership.
It's a private-public relationship. It's not only the National Department of Health. We've got CDC, we've got USAID, we've got Gilead, we've got the SABC Foundation. There's various other NGOs that are actually partaking in this, which is actually amazing because the more hands you have on deck, the better the impact. We have also this year, we're actually proud to say Gifters of Givers have joined on board, and they're also coming with their strength to also, contribute to this cause. The National Department of Health we're trying to, as Rotarians, extend what it is that they're already providing, to go deeper into the communities, because that's where we service and this is where we are normally. So now we were trying to amplify, and try and reach as many people as you possibly can.
All right. So when is the campaign starting? Is it today, the 3rd?
Today we're launching in Mpumalanga. Okay. And then, so the program is a 3-day program. It will run from today, the 3rd, the 4th, and the 5th. So you can contact 08000 12322 to find out where's your nearest location in your community.
All right, beautiful initiative indeed, Charlotte. We'll leave it at that for now, but thank you so much for coming
Thank you so much for this opportunity.
Thank you so much indeed. Well, thank you to Rotarian Charlotte Khoza talking to us about free healthcare services for the disadvantaged communities. As we said, they're starting officially today in Mpumalanga. That's the official launch, and it will run until Thursday. So make sure that you do get to your nearest center to get your health checked.